Hey there, everyone. We're diving into a really important topic, Alzheimer's disease. This condition affects millions of people around the world and often goes unnoticed until its effects become devastating. So, get comfy because we're going to explore the symptoms, stages, and the care required for those living with this disease. So, first things first, what exactly is Alzheimer's disease? It's a progressive and fatal neurodegenerative disorder that impacts memory, reasoning, and a bunch of cognitive functions. Imagine your brain as a giant file cabinet, and slowly but surely, that cabinet is falling apart. Let's take a closer look at how this happens. Alzheimer's sets in when the processing of certain proteins in our central nervous system starts to go awry. This leads to the formation of poorly cut protein fragments that become toxic, ultimately resulting in the death of neurons in crucial areas of the brain, like the hippocampus and the cerebral cortex. The hippocampus is essential for memory, while the cortex is responsible for language, reasoning, and even sensory recognition. Here's a key point. The exact cause of Alzheimer's is still unknown, but many believe there's a genetic component involved. What we do know is that it's the most common form of dementia among the elderly, accounting for over half of all dementia cases. And who are the caregivers? They play a vital role in the lives of patients. Whether they're nurses, healthcare professionals, or even family members, everyone has an important part to play in ensuring the patient has a good quality of life. Care extends from nutrition to making the living environment as supportive as possible. Let's now discuss the stages of Alzheimer's. Unfortunately, the disease usually progresses slowly and inexorably. On average, the life expectancy after diagnosis ranges from 8 to 10 years, and the progression is divided into 4 stages. Stage 1, early stage. This is where memory, personality, and visual skills start to change. Stage 2, moderate stage. Here, individuals may struggle to speak and complete simple tasks. Agitation and insomnia can set in. Stage 3, severe stage. Patients may resist completing daily tasks and could experience urinary and fecal incontinence, along with difficulties in eating. Stage 4, terminal stage. The individual may be confined to bed, become mute, and experience pain while swallowing. These stages are essential for understanding how the disease advances and what kind of care is needed at each phase. Now, let's talk about the symptoms. The first and most characteristic symptom of Alzheimer's is recent memory loss. As the disease progresses, more severe symptoms appear, including irritability, difficulties in language, and disorientation in space and time. Some of the main signs include forgetting recent events, repeating the same question multiple times, difficulty following complex conversations, trouble finding the right words, mood changes like irritability and unwarranted suspicion. It's important to remember that everyone may show a different combination of these symptoms. Next up, let's discuss the risk factors. Age is a major one, along with a family history of dementia. Individuals with lower educational levels may also be at greater risk, as more complex intellectual activities help create new neural connections, potentially compensating for neuron loss. And what about prevention? While there's no specific way to prevent Alzheimer's, keeping your mind active and having a vibrant social life can help. Here are some tips. Study and read regularly. Do mental math exercises. Engage in brain games. Participate in group activities. Avoid smoking. Limit alcohol consumption. Maintain a healthy and balanced diet. Stay physically active. These actions can help keep your brain engaged and may slow the onset of symptoms. So, how is the diagnosis made? Diagnosing Alzheimer's is often a process of elimination. Typically, it's done by geriatric psychiatrists or neurologists. Initial evaluations usually include tests for depression and laboratory work to assess thyroid function and vitamin B12 levels. Early identification is crucial. Appropriate treatment can help alleviate symptoms and slow the progression of the disease. In conclusion, Alzheimer's disease is a complex condition that requires careful attention and care. Raising awareness about the disease and its symptoms is essential for helping those who are navigating this journey. If you or someone you know is facing these challenges, don't hesitate to seek specialized help. And, of course, if you found this video helpful, Please give it a thumbs up, subscribe, and hit that notification bell for more content on health and well-being. Thanks for watching, everyone. Until next time, take care.